My name is Elise Smith, and this is my injection checkoff video. So first and foremost, I already have my gloves on because this is like the third time I've tried to record this, and I am running out of gloves. And my kit does not have a blunt tip needle in it, so I'm just going to go ahead and use the same needle to draw as I am to inject. So first, we always start at the Pyxis. So I'm checking my patient orders. I see that I'm giving Humulin NPH, Humulin R, which is regular, and an antibiotic called ceftriaxone. So first I grab my vials. You want to check and make sure that they are not expired. Grab your alcohol swab, grab my needles, and in this case, the fat pad as well. So I am checking the chart, the patient's chart against the MAR as well to make sure that everything is good there, like that there's no allergies or contraindications, and for the insulin specifically, making sure that the blood pressure or blood sugar is appropriate to give insulin, and it is 180, so it is appropriate for this instance. So now, transitioning, knock, knock, knock. I would enter the room, perform hand hygiene, put on my gloves, introduce myself, let the patient know why I'm there, ask to verify their name and date of birth against the wristband, and then upon explaining why I'm there, then I would ask if patient S has any known drug allergies, just to make sure in case they're not listed on the chart as well. So there are no allergies, blood sugar is good. So we're ready there. He has expressed that he wants insulin first. So I'm going to go ahead and do those first. So to start, I'm going to sanitize with the other side. And put that there. So for the NPH, I need 15 units. So I'm going to go ahead and get my syringe, and I will go to 15 on here on the syringe, enter 15 units of air into the bottle. Then I'm going to go to 13 units, enter 13 units of air into regular. Okay, now I'm going to withdraw 15 units of NPH. And then I'm going to withdraw 13 units of regular. So I want 28 units total. And since this is a high alert medication, I'm going to have another nurse double check that there are 28 units. So then I'm going to put this right here in the cap. I'm going to go ahead and clean the patient's arm, because this is, no. This is subcutaneous. This is cleaning the abdomen. We don't want it, it's 2 inches from the umbilicus, and 2 inches away from any wound that might be on the abdomen. So for this, we want to pinch an inch. Let me get my syringe. So you pinch an inch, and then this goes at a 90-degree angle. So you're inserting, push in. And then we don't want to rub the site because that could cause a hematoma, but we do want to let the patient know that there could be bruising or redness, tenderness at the site of injection, as well as not to rub it, because we could cause a hematoma if we rub the site. So I'm going to dispose of this in the sharps container. And now I am moving on to ceftriaxone. Okay. So we get this, clean this. And I think in her video, she may have done it all at once, which in hindsight now that makes a little bit more sense. So you're just ready and then you give the injection. I did not do that, but I'll add that. So again, I don't have a blunt tip needle, so I'm just going to go ahead and use this. I'm going to open. It is an IM antibiotic, so it's going to go in the muscle of the deltoid, up in the upper arm. The MAR calls for 750 milligrams, so that is 0.5 milliliters. So I'm going to go ahead and inject 0.5 milliliters of air. And now I'm going to withdraw 0.5 milliliters. Okay. And for this, this is going IM in the deltoid, and we want to use the Z track pattern to displace the skin over the muscle, and then we'll put the skin back on top of the muscle. But so we want to be 2 fingers below the acromion process, and then we'll do the, also we want to sanitize the skin with an alcohol wipe. So there we go. And this can also go in a 90-degree angle. Okay. So then once I'm done, I'm going to initiate the safety, is what I would do. But I'm going to go ahead and save this just in case we need it again. And then I would dispose of this in the sharps container as well. So with the antibiotic, we want to make sure that he knows, or patient S knows, the side effects and things to look for, but also to not be alarmed that he could experience some GI upset, so some nausea, vomiting, diarrhea, and that those are the things to look for, but don't be alarmed that nothing is particularly wrong. Also, going back to the insulin, hypoglycemia is something to alert the nurse about if he's feeling symptoms of that. So we've done the injections. We're done with that. Also, before I had done this, I would have asked if he had any questions. And now I'm going to go ahead and lower the bed back down, make sure the call button's in reach, let him know that I'll be back within 30 minutes. I'm going to dispose of my gloves, and I'm going to go document everything that we have done in this instance. So that's all. Thanks.